Great. Hello, everyone. Welcome to another episode of Specialty Spotlight here on my channel, White Coats and Corgis. Most of you probably know me from Instagram or TikTok, where I make helpful free content for pre-meds and talk about my journey as a first-generation medical student. My mission here on YouTube is to give pre-med students all the important information they need for a career in medicine. Today, I'm joined by a very special guest, Dr. Ragav Sharma, who is a second-year PM&R resident. Dr. Sharma, thank you so much for taking the time to educate us all about your specialty.
Absolutely. Look forward to the conversation.
Awesome. So the first question I have is pretty broad. Just why did you choose your specialty?
Yeah, so I think choosing a specialty is a difficult decision. And I think a lot of it, it depends on a lot of different factors. But for me, one of the things that I've always been interested in is kind of the musculoskeletal system, as far as kind of how it relates to athletics and just performance in general. So I actually found out about physical medicine and rehabilitation, PM&R, before I started medical school. It was the first physician that I shadowed, just ended up being a PM&R doctor. And I immediately found that this is the field that is addressing the musculoskeletal system more than any other field does. So that's kind of why I ended up pursuing it. The more I learned about it throughout medical school, through exposure, it was just more and more kind of reinforcing that same kind of philosophy that I had regarding medicine, as far as my interest and what I like as far as patient care and what I prefer, all those kinds of things. So that's kind of where I am.
Very cool. And you mentioned a lot of great things that you enjoy about PM&R. If you had to pick one, what is your favorite thing about the specialty?
My favorite thing is that we have a kind of different philosophy regarding patient care overall to most of medicine. So most of medicine sees the patient as they come in with any sort of acute problem. So let's say the patient comes in through the pathway of the emergency room. They have some acute problem. Emergency medicine physician is going to see them. They may or may not get admitted. If they're admitted, there's going to be a hospitalist or an internal medicine doctor, and then whoever else they need on the team to address that acute issue. Now, what physical medicine rehab focuses on is, after that acute issue, how do we get this patient home and get them doing what they want to be doing? So there may still be a lot of medical issues or whatever else going on for this patient, and you are managing those after the hyper acute period, but you're helping them navigate how they're going to get back home, get back to doing the things that they enjoy. And that really brings me satisfaction, because you're thinking about their life and how to get them to enjoy it. And that personally something that I really enjoy.
That is so awesome. That sounds really great. One of the things that I was really interested in, I always ask people this, is what's one thing that you don't like so much about your specialty and what can be done to change it?
So this is a difficult question. Every specialty has their kind of things that are more or less, someone may not like it, someone may love it, and it's all very dependent on the person. For me personally, I do like to focus a little bit more on kind of the more acute stuff versus just managing all these chronic issues. I like taking charge of my patients. And sometimes when you have patients that come to physical medicine, like the acute inpatient side, you are carrying out the orders of other physicians on the acute side. I'd love to have a little bit more control over what I would want to do, but for kind of legal purposes, liability and all of that, as far as medicine goes, we can't. So that's something that I don't think will ever change, but it's something that's a little annoying to me.
Got it. Absolutely. So now I'm going to shift gears a little bit and ask you a little bit about your journey to where you are today. So I know we have listeners of all different ages listening. Would you take us through kind of your journey as a pre-med to a medical student and now as a resident?
Sure. So as cliche as it is, I had my own medical issues when I was a younger child. So I was kind of always inspired to become a physician. So growing up through kind of all basic schools, I had that inkling in the back of my mind that I want to be a physician. But when I got to undergraduate kind of studies, then I saw that a lot of people that go into medicine are studying things like biology, chemistry. And for myself, I felt like that was going to be boring for me because I have a very short attention span. So I chose something a little bit more challenging as bioengineering or biomedical engineering, depending on what the school calls it. And I still had the sole idea that I still want to do medicine, just take maybe a little bit more of an interesting route in it and learn more about kind of the device side and how that applies to what we ultimately do in medicine as we're using these devices to take care of patients. So I went through undergrad with that kind of idea in mind. I did all of my pre-med kind of required classes along with that. took the MCAT back when there was a score. There's still a score, correct?
Yes, there is.
Oh, sorry, that's step one that changed.
Yes.
Forgot about that. So yeah, took MCAT, ended up being accepted to a medical school right out of undergrad, and then finished medical school. The first 2 years were, I guess the first year was a little bit more challenging for myself because coming from engineering, it is very different than kind of the subject material within medical school. You study for tests very differently, whereas in engineering, you're kind of given the it's essentially open textbook like tests because they just give you a problem, you're supposed to solve it using the tools that you have in engineering. Whereas in medicine, it's just kind of brute memorization of a lot of different things and putting together different organ systems. It's very different. So the first year was a little bit rocky for me. Eventually, I figured out how to study and kind of switch to that kind of mode. And then it went on from there. My third and fourth years, just kept getting more clinical exposure, really loved it, loved taking care of patients, and then ended up applying for residency and then finished my intern year. And here I am.
Wow, that's awesome. Engineering is very cool. Did you feel that it sort of disadvantaged you not doing a traditional like biology type of major, or did you actually like having a non-traditional major?
Sure. So obviously my GPA could have been much better if I did something that was more traditional. I challenged myself quite a bit, especially in my freshman year of undergrad, because I was still taking like the higher level pre-med courses like Orgo 1 and 2 on top of all this engineering course load. So I enjoyed the challenge. I thought it was relatively enjoyable. I met some great people, learned a lot of things, but obviously disadvantaged myself a little bit as far as the GPA, but it ended up being okay.
Yeah, great. It all worked out in the end, right?
Yep.
So for our pre-meds who are listening, I know a lot of questions I get on my channel all the time is just what are some good activities that I can do to learn more about the medical field? And is there any activity that you would suggest maybe specifically for people who would be interested in PM&R?
So I think the biggest thing for pre-medical students is really most people don't understand what medicine is about. And even as medical students, oftentimes you don't really get what medicine is because you have very limited exposure to it. Even as a medical student, until you're going through the day-to-day life of it, it's very challenging to understand what it is that we do within medicine as physicians. So I think for pre-meds, locking yourself into kind of going the medical route of going to medical school, you're kind of committing to that route of becoming a physician. The biggest thing for me would be to shadow. Find opportunities, find physicians to just go watch them. You don't have to be like learning about medicine at this point. Just look at them, ask them questions about their day, ask them questions about what they like, what they don't like, about what different specialties do, how their specialty fits in within others, all these different kinds of things. Just gain a general awareness for what medicine is like. And I think that'll go a long way when it comes to applications, because then you have stuff to talk about. You can relate to it. And then you can also figure out whether medicine is right for you. Because there's a lot of people in residency who get to this point and they're like, I should have done something else. I didn't realize it was going to be like this. Whereas if you shadow it when you're a pre-med, you kind of know a little bit more about what you're getting yourself into.
Yeah, I completely agree. I shadowed, I think, 3 different medical specialties when I was a pre-med, and I really wish I had done more because there's so many specialties out there, and it's really hard to kind of get exposure to all of them, which is part of what inspired me to make this series. But yeah, so for medical students who are a little bit farther along in their journey, what would you recommend, if they're interested in PM&R, what's a good way to get exposure to that now as a medical student?
I think the same advice stands. When you are a first and second year medical student, depending on your curriculum, you largely have a fair amount of time outside of your regular studying for your tests where you can pursue and kind of figure out what you want to do within medicine. Once you get to your third and fourth years, you're kind of locked within a curriculum, depending on the school, and you have to follow certain rotation kind of patterns. So the same idea stands, but now when you're a medical student, you have a little bit more to relate with. You can ask the physician a little bit more about their specialty. You have more context of questions to ask them. So I think still when you're a medical student, shadow as much as you can within the specialty that you want. A lot of people go into kind of their clinical rotations thinking, I want to become a surgeon. And then it turns out that their surgery rotation isn't until the end of their third year. And then they get to it and then they realize, oh, surgery is not for me. But at this point, you've put all your eggs kind of in that one basket of I'm going to be a surgeon. You realize it isn't for you. And then when applications come by for residence, you end up scrambling. So setting up opportunities to shadow or setting up opportunities for whatever field that you're interested in to get that very early on within your rotation schedule in third and fourth years would probably be my best advice.
Yeah, that sounds like some great advice. And I know PM&R is not part of the core rotations at most medical schools. So how quickly can you get exposure to the PM&R rotation?
So you can get exposure. It depends what capacity you want to get exposure in. A lot of physiatrists is what you call PM&R doc, like not a psychiatrist, but a physiatrist. A lot of physiatrists out there are very open to people shadowing them. That we're very passionate about our field and what we do. So when you are an M1, send out emails if your hospital has a PM&R department, or if you live in a city which has like a clinic that's run by a PM&R doctor, then just message them. What I did when I was trying to shadow before medical school was I got the trial of LinkedIn Premium and just found people in the area and messaged them. So definitely do that. The earlier, the better, so that you have more exposure. And then whatever your school allows, if you're allowed to set up your rotations as doing PM&R first, then be it that way, because schools are supposed to be there to help you figure out what you want to do with your life at the end of the day. So work within the confines, but definitely you can also go out of your way and just message people.
Yeah, that's great advice. I love that about LinkedIn. I hadn't thought about that. I may have to use that one myself.
Yeah, it works great.
Awesome. All right. So the next question I had is a little bit longer. So I'm going to break it up into two parts. It's basically a day in the life. So people want to know what a typical day is like, but I know that in residency, it can look quite different than how it looks as an attending. So could you tell us a little bit about kind of a day in the life now versus when you're an attending?
So I think the day in life is actually pretty similar between most residencies and attendings. It's just the amount of responsibilities and administrative stuff increases as you become an attending. So right now, as far as physical medicine rehab, the thing about the field is that there are so many different areas that you can practice within physical medicine and rehab itself that you can ask 10 physiatrists what their day looks like, and all of them will be different. There's just so much scope and variety to the field. But one of the things, or the rotation, kind of the service that I'm on right now, is an inpatient service on traumatic brain injury. And what the day looks like is very similar to kind of internal medicine, or what you would think of as the traditional. You go, you chart check your patients, you do your rounds, you act on all the orders, and then you kind of just navigate the day as it comes through. You take admissions, you do discharges. It's pretty similar workflow to most other specialties. The only thing that we really add in there is that PM&R is a very collaborative specialty. We rely heavily on therapists, as far as physical therapists, occupational therapists, speech language pathology specialists. So we incorporate a lot of their data. So there's a lot of times where we meet and talk about patients and see what their goals are, see what we need to adjust, all those different kinds of things. So I think it's a day in the life. That's a very basic inpatient day in the life, but there's a lot of scope for like procedures and other things that you can do that vastly will change what a day in the life looks like.
Very interesting. So you mentioned that there's a difference between inpatient and outpatient. Could you elaborate a little bit on that?
Sure. So once again, even in the outpatient setting, there's a lot of different kinds of things that you might be seeing. As an outpatient, you might be practicing as, let's say, if you're practicing as a sports medicine physician, where you have patients with acute musculoskeletal injuries that are presenting to your clinic, as an outpatient, and you're kind of diagnosing their injuries, whatever it may be. You can also, as a physiatrist, do injections of various joints. So you can have a day where you're just kind of injecting patients for whatever they might need, whether, let's say, you're doing a shoulder injection, a knee injection, whatever it is that they may need. On the other hand, if you are practicing more like spinal cord medicine or traumatic brain injury medicine, then you might be performing other kinds of injections, seeing patients in different capacities. There's just a whole bunch of different things you could be doing, but generally you're seeing patients in a clinic as an outpatient, whereas you're seeing hospitalized patients as an inpatient.
Got it. Okay. And then to kind of piggyback off of that, is there a difference in the hours that you work between inpatient and outpatient?
So inpatient is always variable, and inpatient always depends on what is going on during that day. Hospitalized patients are, I don't want to say they're like, you never know what's going to happen as an inpatient, because patients are generally sicker. They have more medical complexity and things that could happen. So the day is very variable. Outpatient days are typically more structured, where you will set your patient schedule. Like I'm going to see patients from 8 a.m. to 3 p.m. or 4 p.m. or whatever you want to put as that cutoff. And that's it. If you're in the inpatient side, let's say 3 or 4 p.m. comes around, then a patient, like something happens to a patient, you have to take care of it because you're the physician. So The hours are similar, but the variability is much greater on the inpatient side.
I see. And then the last question I have in this category is about what you can do after your residency. So are there different fellowships that you can pursue? Kind of what are the different directions that you can go in as a PM&R doctor?
Absolutely. So like I was saying, if you talk to 10 different physiatrists, you might get 10 different types of practices. So within physiatry, there are a multitude of fellowships. I think I'm going to miss a couple of them as I list these through, but there's specialties or fellowships such as sports medicine. You can do spinal cord injury. You can do traumatic brain injury. You can do pediatrics. You can do fellowship in things like spasticity, which is a specific medical condition that a lot of people suffer from if they have upper motor neuron injuries, which I don't know if you people listening to this or whoever's listening to this understands what that is, but specific condition. You can do cancer rehab. You can do very specific like interventional pain rehab where you're practicing and kind of doing injections on the axial spine. I think that's 7 of them. I'm sure there's a couple more that I'm missing off the top of my head, but that's 7 already. Or is that 8? So there's a lot that you can do.
Yeah, that's a lot. Wow. Do you have any idea what direction you might want to go in?
Yeah, so I've always been interested in the musculoskeletal system and diagnosing and treating those kinds of injuries. So as far as it goes right now, I'm leaning towards sports medicine.
Got it. Very cool. All right. So moving on to a little bit about the process of becoming a PM&R doctor, we want to talk a little bit about the match process. So I know that this is something that stresses out a lot of medical students, the competitiveness and just the length of the application, interviews, all that kind of stuff. So could you tell us a little bit about your personal experience with the match?
Sure. So if you're a pre-med, you're probably not going to understand what this is. So I'll give a little bit of context. So how residency gets decided is through a entire very lengthy process called the match, as that was just described. And what this is where you apply to, there's a ton of programs out there. You apply to however many programs you want to, depending on how competitive you think you are. And then all these programs can choose whether or not they want to interview you. So then you interview at all these places. Now, unlike any sort of traditional job, instead of like accepting something from an interview or them accepting you and you can accept them, all that kind of stuff, what happens is that you rank all of the programs that you apply, that you interviewed at. So literally you rank them on a list of like 1 to however many interviews that you have. Now, every program out there ranks every single candidate that they interviewed as well. So let's say they interviewed like 100 or 150 candidates. They will rank all of them in a gigantic list of preference of who they want to take. Now, what happens on match day is that some fancy magical algorithm matches everything together and they try to match the applicant's choices with the program's choices. And when people say they had got like their first match, then that means that the program ranked them within one of their first spots for however many residents they take. And then that applicant ranked them first as that's the program that they wanted to go to. So it's a very lengthy and very complicated process, but it requires some context because it's very unique to medicine. Most people don't really understand it because it doesn't really follow the traditional job application type of thing. My route through that and navigating it. So I'm the first physician in my family. So I didn't really have anyone kind of ahead of me to explain this entire process to me, but I was very fortunate to have great mentors and great friends who had other siblings or other friends that had gone through this. So I was able to rely on them heavily. I think the match went pretty well for me. And I ended up matching into physical medicine and rehab in a program that I really like. And that's where we are.
Awesome. Well, thank you for that explanation. I know it's really complicated and kind of hard for people to understand, especially, when they haven't been through something like that. I'm also a first generation student. What would you recommend for students who don't really know anybody who has gone through this process before to kind of get the information they need?
Make friends with upperclassmen. If you're an M1, make friends with M2s and M3s. You'll find them at like various club interest groups. So then that way, if when you become friendly with them, when the time comes, you can send them a text, send them a message, whatever it is, and say, hey, I had a question about this. Do you mind helping me out?
Yeah,
That's probably the best way to go about it.
that is great advice. Thank you. And then how difficult do you think it is to match into a PM&R residency?
So this is a very interesting question because in the past, let's say about a decade ago, physical medicine rehabilitation was not competitive at all. It was one of those specialties where a lot of people hardly even knew about it. So just being able to, like, someone's like, hey, he's applying physical medicine and rehab, was kind of a surprise. So it wasn't very competitive, but with the law of kind of economics and supply and demand, more and more people are wanting to become physiatrists. It's getting very competitive these days. I think every year it gets more and more competitive. If you look at the match data through the NRMP and the ACGME, then it is one of those specialties where there are now more and more people that are going unmatched, which means that they're not getting into a spot, which historically was never the case. So in the next several years, it's going to become more and more competitive. I can't say exactly how competitive it's going to be, but it's getting there.
Wow, interesting. So that is pretty scary, for someone like me who's a medical student. What advice would you give us to make ourselves competitive applicants in this process?
Sure. So as far as what I know right now, based on trends, is that physical medicine and rehab is still one of those fields where people somehow still don't know about it. They don't know what a physiatrist does. And a lot of times in applications, people really want to see interest in the field. So get involved. And like I was saying with the shadowing early, it doesn't hurt to do it as early as you can if you think you're interested in it. And then just once you have a foot in the door and you've shadowed someone, ask them for opportunities, figure out what you can do, and just get involved within the field. Obviously, doing well within your core curriculum, doing well in your rotations, and scoring well on step 2 now, because step 1 is pass fail, are all priorities as well. But just really getting exposure into the field and getting involved is probably the best way outside of the basics.
Great. All right. Well, that was my last question. Thank you so much for being here today. We really appreciate it.
Absolutely. If anyone has any questions regarding medicine or physical medicine rehab, feel free to shoot me a DM and I'd be happy to respond.
Yes, I will have all of your contact information linked in the description. So be sure to follow him on all socials. And thank you so much again.
Absolutely. Thank you.